Hello everyone, my name is Jennifer Morales and today I will be presenting botulism. A lot of you may be wondering what it is, where it comes from, and what things it can do to your body. Throughout this presentation, I hope to answer all of your questions and concerns. Botulism is a disease that attacks the nervous system of both animals and humans. The origin of this disease is in Europe. The first case was found in 1735. The name botulism comes from the Latin word for sausage, Botulus. This is a neuroparalytic condition that is caused by neurotoxins that come from spores, Clostridium botulinum. Botulism is also a gram-positive bacilli, and under the microscope it looks as the picture right beside me. Botulism is also an obligate anaerobe, which means it does not need oxygen to be activated and spread. There are 3 different ways of transmission for botulism. One being the most common, ingestion. Secondly, inhalation, which only occurs in a scenery such as a laboratory. And lastly, direct inoculation, which is the open wound and the infection gets in. Epidemiology and clinical information. Botulism can show mild to severe symptoms on both infants and adults. The symptoms begin to appear from 12 to 72 hours within having consumed the contaminated foods. Incubation time can vary depending on how the person got infected. If left untreated, botulism can be deadly. A full recovery can last from weeks to even months. And finding characteristics are that the person has no fever, the patient is definitely alert, responsive, their blood pressure is normal, they can result in paralysis. However, they are tachycardic, meaning their pulse is really fast. Pathogenesis. Clostridium botulinum results in neurotoxins, and those neurotoxins respond to spores. Spores exist in rivers, seawaters, and even soil. Neurotoxins are created by the stress of spores. Environments in which conduct the spores, or expand them in other words, are room temperatures, no oxygen, and acidic waters, possibly over 4.6 pH level. And strands that show and create disease in humans are A, B, E, and F, sometimes even G and H. In the picture to the side, you will see that there is a normal neutron and then the activated neutron. So here you see 4 different types of botulism: foodborne, wound, infant, and adult intestinal colonization. Something very important you must know about botulism is that no matter how many types, at the end of the day, if it is untreated, it is still deadly. Okay, so let's talk about foodborne botulism. We know that botulism is an obligate anaerobe that does not need oxygen to be activated and spread. So out of the cases that are annually reported in the United States, 25% are foodborne toxins. And that is mostly because our canned foods especially are left out at room temperature, and what better way for the bacteria to spread itself, right? However, it is our job to cook the food correctly and make sure it boils and cooks all the way so that we do not get infected. Okay, so moving forward, we have the wound botulism, which means when you have a cut, the infection gets to you and now you are intoxicated, right? So it is important to know that no matter how big or how small a cut may be, you want to clean it up and patch it up. Those are 2 things you should always do: clean up your wounds and patch them up. Especially knowing that 30 to 40% of the reported cases of botulism are because of wound infections. Lastly, I'm going to talk about adult and infant intestinal colonization. It is very, very, very important to take in consideration that 70% of the cases that are reported to the United States government on botulism are infants. Mostly 2 to 8 month old infants are infected with botulism, and this is because the spores grow within the baby's intestinal tract. And it is very important to know that this has long-term effects. As to adult intestinal colonization, it is important to know that it's similar to infants, but it is not as high. It affects the intestinal bypass. It affects and disrupts your normal intestinal floral, and you have bowel abnormalities. So here in this slide, we see some symptoms for both infants and adults. So for adults, we had blurred vision, double vision, weakness, vomiting, dry mouth, paralysis, dyspnea, tachycardia, dysphagia, difficulty urinating, and droopy eyelids, which is the most common. As for infants, we see drooling, constipation, vomiting, floppy movements, weak cry, amongst others. So moving on, we have the diagnosis. Detection of toxin on both infants and adults is the same. You can use gastric contacts, blood sample, and feces. Now, treatment. So for adults, we have antibiotics, gastric lavage, which is cleaning out their stomach. However, you can only do this if you know that you have been intoxicated, and this can only be done within hours. A taxoid, support and assistance from family, friends, a nurse, the ICU, doctors, anyone you can get help from. A ventilator to help you breathe. Physical therapy is always very helpful. And then we have treatment for infants, and antitoxin, and all assistance, obviously a ventilator, people to help them because they're children, they're small, they need help. However, antibiotics are a big no for children. And that is because it can lead to too much release of the good stuff in the baby's stomach. So for children, the treatment would be antitoxin, all assistance, obviously, because they're babies, they need help with everything, a ventilator, food, changing, everything. However, you do not give a baby antibiotics, and the reason being is because you are already giving this baby antitoxin, which is helping it throw emesis and get rid of all the bad stuff in their stomach, and through feces, through urine, all of that will eliminate the bad stuff in the baby. And if you add antibiotics to that, it can cause the baby to release too much, including the good stuff, such as protein, and things that make the baby healthy. Alrighty, everyone, so we made it to the last slide, and it's prevention. So you want to know how to prevent yourself and your family from getting sick. Practice safe food canning. So if there's a can that is leaking or has a bulging end, just throw it out. Make sure you boil canned food for at least 10 minutes before you eat it. Rinse and wash your hands always, and your fruits and vegetables. You should be doing that. Avoid feeding kids under 1 year old honey and corn syrup. It is not good for them. When you're doubtful about something, just throw it out. Do not taste food to determine whether it is good or not for others to consume. Just throw it out. And always seek medical attention, especially if you have a big wound. Otherwise, just clean it up and patch it up. Alright, guys, so these right here are my sources. I used videos and many articles, and I got my information. Hey guys, so if you made it here, thank you so much for watching my entire video. I know I talk a lot, I'm sorry. But I appreciate you guys watching my video. I hope you guys gained some knowledge. If you have any questions or concerns that I did not answer, I apologize. Please leave them down below and I will answer all of your questions. I hope you guys are safe. Take care of yourselves and good luck.